Hey there everybody, welcome back to MedEd Insights. For those new to this channel, my name is Brian and I'm a second year physical medicine and rehabilitation resident at Mayo Clinic. And this YouTube page is all about giving you some insight and tips on medical education, medical training, and exposing you to what my life is like as a physical medicine and rehab resident here at Mayo Clinic. Now, residency application season is just around the corner with the September date for sending off applications fast approaching. And so with this, everybody is being asked in medical school, what specialty are you going into or what are you applying for? And so when people think about what type of doctor they want to be, this is what they're often referring to. What specific specialty do they want to go into and what type of practice do they want to have? Well, in today's video, I want to get you to think a little bit differently about answering that question, what type of doctor do you want to be? And I'm going to tell you, you can really be whatever type of doctor you want. Now, we all go through the process when we're in medical school and trying to decide which field to go into of looking at this question of what type of doctor we want to be in terms of the specialty that we want to go into. You know, you ask yourself the question, do I want to be a surgeon or do I want to be an internist? Do I want to take care of adults or do I want to take care of kids? There's a lot of these questions you ask along the way when trying to decide what type of specialty you want to go into. But I think there's a whole other question you should be asking yourself as you're applying for residency and starting to make those next preparations and thoughts into your actual training and career once you're done with medical school. And that's more this question of what type of doctor do you want to be? And when I say that, I don't mean what type of specialty. Rather, I mean like actually how do you want to act and how do you want to practice as a doctor? One of the coolest things I've learned so far finishing up my intern year last year and then starting off in PM&R this year is you'll learn that once you're done with medical school, you're sort of free from these restrictions of having to conform to a set identity of what you think is necessary in order to succeed in medical school. And you start to learn that you have a little bit more freedom to develop your own unique style and way of practice when it comes to taking care of patients. And I think this is honestly my favorite part of residency. You start to have this freedom where you can choose how you want to interact with your patients and how you want to perform different activities of a physician on a daily basis beyond what specific specialty you belong to or are going into. And one of the valuable reasons I think this is important is because when we're in medical school, we get stuck in these stereotypes of what different fields of medicine or what types of doctors are supposed to act like. And it's easy to think that this is how we have to act as well if we're going to go into that field. So, you know, the common stereotypes are that neurologists are super nerdy and that orthopedic surgeons are just all jocks who like to work out and lift weights. Or that, you know, neurosurgeons think really highly of themselves and can have large egos. And I think that it's really important to debunk those stereotypes and understand that regardless of what specialty you're going into, you have the freedom to choose what type of physician you actually want to be in terms of how you're acting and how you're interacting with your patients. Just because you want to be a surgeon doesn't mean that you have to sacrifice having really good bedside manner just because that's what you read about when it comes to surgeons and their personalities. I think a lot of times people get concerned about the specialty of their choice because they're afraid of these stereotypes and think that it'll confine them to how they have to actually practice on a daily basis and what type of person they have to be. Well, I want to reassure you that that's not true and that you shouldn't let that define you as a physician when you're choosing your specialty and getting ready to apply here during fourth year. Regardless of what field we're going into, we all have this overarching responsibility and dedication to patient care and wanting to really truly help other people. And the great part about being a doctor is you can sort of fine tune and tweak your individual style and ways of how you want to help people. If you're the type of person who wants to be very serious with your patients, then that's okay. Do what's comfortable for you and be really serious. But if you're the type of person who's much more laid back and, you know, wants to tell a joke to your patient in the appropriate moment, that's okay too. That's exactly what I'm saying, is you have this ability to be the type of doctor that you want to be beyond how your specialty defines you. You know, one of my favorite movies of all time is actually Patch Adams, and I'm sure a lot of people have seen it, but there's this really cool scene at the end where he's in the kind of big courtroom area and they're trying to decide if they're going to expel him. And everybody knows Patch Adams, you know, he wore the clown nose, he acted really silly with his patients, and everybody said that you can't do that because that's not the traditional way that a doctor is supposed to act. And that character said, well, you know, I don't really care. This is how I'm comfortable. This is how I'm interacting and making a difference with my patients. And there's this great scene where he says essentially, if you treat a disease, sometimes you'll win and sometimes you'll lose. But if you treat a person, I guarantee you'll win every single time.
A doctor's mission should be not just to prevent death, but also to improve the quality of life. That's why you treat a disease, you win, you lose. You treat a person, I guarantee you'll win no matter what the outcome.
And personally, that's the sort of idea that I try to hold true to whenever I'm taking care of patients is I don't want to see myself as a type of person who's specifically treating their disease or specifically treating their illness, but rather the type of person that is treating them as a person, because I know that for me, that's the best and truest way that I can connect with my patients and really help them. That's the sort of identity that I want to develop whenever I'm taking care of my patients. And that doesn't mean that everybody has to be that way, but I want to tell you that don't let your specialty stereotypes define what type of doctor you have to be. Don't be afraid to go outside of those stereotypes, be in your comfort zone, and take care of patients and interact with these people in the way that you truly want to interact and help them. Don't be afraid of what people in your field are going to think in terms of you being different from the norm or you being weird or standing out in some way. When you're applying and getting ready to go on your interviews, don't just think about what type of specialty or what type of surgeon, but think about what type of doctor you want to be as a human being and as a person. And I guarantee you that when you look back on your career down the road, that's really going to be what defines how you cared for your patients and how they think of you as a physician. So that's it for this video, everybody. Thank you for watching. Good luck to all the fourth years getting ready to submit their applications for residency. We'll do some videos here in the future talking about some different tips on how to really excel on your interview trips and really make the most out of your application. Thanks again, as always, for watching this video. I hope you enjoyed it. Give me the thumbs up button if you liked it. Let me know any comments as well about different stereotypes or how you feel that relates to your field and how you personally want to act as a physician. What are your own little quirks? What are your own little ways that you like to connect with your patients, and how do you feel like that defines you? Kind of similar to how I shared my own story. So thanks as always for watching. Appreciate it, and we'll talk to you next time, guys. Bye.